Hey everyone, in this video we're going to discuss about something really interesting, that is the investigation of an epidemic. So epidemic is defined as occurrence of any illness or any health related event in excess of normal expectancy. So anything which is in excess of what is expected, that is called an epidemic, right? So with an pandemic going on, which was earlier an epidemic, we need to know how an epidemic is investigated and how the epidemic is confirmed and declared an epidemic. So, what are the investigations that we do for an epidemic? So, before knowing that, let's know what are the objectives of investigating an epidemic. So, the objectives, the first is to define the magnitude of the epidemic, how big or small it is, then to determine the conditions and factors responsible for its occurrence, like which conditions led to the epidemic, then identify the cause, the source of infection, the modes of transmission. So this information is useful for finding out the measures to control the epidemic, then recommendations to prevent its recurrence. So these are the objectives. Then moving on to different steps of investigation, we first have verification of diagnosis, then confirmation of existence of an epidemic, then defining the population at risk, then rapid search for all cases, then data analysis, then formulation of hypothesis, then testing of this hypothesis, then evaluation of ecological factors, then further investigation of population at risk and the report. So these are the 10 steps of investigating an epidemic. I'm going to be discussing each and every step in detail. So let's dive in. So the first one, the verification of diagnosis. So this must be done on the spot or as quickly as possible to rule out any misinterpretation. So first, if suppose a COVID case has been diagnosed earlier in December in China, so first you need to confirm the diagnosis first. So is it COVID actually, or is it some other flu? So the clinical examination is the most preferred. Even the lab and investigations are more confirmatory, but it should not be delayed. The result should be out as soon as possible because it is an epidemic, right? So then we confirm the existence of an epidemic. So after we confirm the diagnosis, we must confirm if it's actually an epidemic. We do this by comparing. So we compare the disease frequency. So how many people are affected? Like, do everyone have the same symptoms? Is it the same disease or not? So by comparing the disease frequency during the period of previous years. So we also compare it with the previous years. Earlier, was there a similar condition before during this period? So that's how we do it. And the number of cases being in excess of expected frequency for that population. So that is an epidemic. So then after confirming the diagnosis, we confirm the existence of an epidemic. Then we define the population at risk. So now we know that it's an epidemic, it's going to spread. So we define the population at risk. So this is done by drawing the map of the area. So we get a map of the area, information about landmarks, roads, locations of dwelling units along the roads, and then you divide it into divisions, then the divisions again into different regions and localities, so that it's easy to define the population who are at risk. Suppose in COVID, we have put red zones, right? So we have put different red zones where the people who are affected and the whole red zone is at risk because they might come in contact with the one affected. Then one is the map of the area and then the counting the population. So this is done to estimate the population at risk, how many people are at risk actually. So then rapid search for all cases. So after defining the population at risk, then we search for all the cases and their characteristics. So all the symptomatic patients, all the cases are searched through a medical survey. So how is this medical survey done? A complete survey picks up all the individuals with symptoms. So this is done by the health workers, the frontline workers, the male health workers, the female health workers. They go on searching for symptomatic patients with the help of an epidemiological case sheet. So this epidemiological case sheet defines, what to actually ask the population at risk, to find out the asymptomatic patients and to put everyone into one group so that it's easy to treat and prevent. So the case interviews form for collecting data from cases and the previous persons who are previously exposed. So then we search for all the cases. So after that, we search for more cases based on the symptoms, based on their contacts. If we find out any cases, we find out their primary and secondary contacts, so we can reach a wider population more specifically. Then data analysis. So after searching for all cases, we do data analysis. In data analysis, it's done by time, place, and person. So first time we draw an epidemic curve is drawn. So based on the time relation with exposure, we see how many people are being exposed and affected with time. So this will tell us if it's a common source or a propagated epidemic, because again in common source you have single source and propagated epidemics, different types. So based on the curve, we get a clear idea about its exposure and the spread of the epidemic, if it has a seasonal or a cyclic pattern. So this is about time. Then in place, we take a spot map. So this will tell about the source of infection and from where it has spread. So this will tell about source of the infection and the spread of the infection. Right? So this is about place. And then person. So we define the person based on age, sex, occupation, and other risk factors. So it's easier to evaluate the other people who are being investigated. So after everything, after data analysis, we're going to formulate a hypothesis. So this is basically an assumption yet. So we formulate a hypothesis about epidemic in terms of the possible source from where it has spread, a causative agent, the possible modes of spread, environmental factors. So for example, earlier, before COVID was even declared as a pandemic, the possible source might be the corona, right? The causative agent could be spread from a pangolin in some streets of China. The possible modes of spread would be a droplet spread, right? Environmental factors is overcrowding, all of that. So this is how we formulated a hypothesis, and it could be and then declared as COVID-19. This is a possibly a pandemic, and this is how it spread. So formulation of hypothesis is important, to come to a conclusion about the epidemic. So then the testing of hypothesis. So just formulating it is not sufficient. You need to declare if it's actually right, that's the hypothesis that is right. So in testing of hypothesis, all reasonable hypothesis needs to be compared by attack rates. So your hypothesis is compared by attack rates if it's actually right. In those exposed and not exposed, you need to test it. Then evaluation of the ecological factors. So after getting the source, everything you see around you. So ecological factors that are supporting the epidemic to occur. So that is, in ecological factors, you have the water sources, you have the air pollution, different sanitary conditions, all of that. Then you have the further investigations. So in further investigations, so it is done for population at risk. So different medical examinations, screening tests, laboratory tests are done to rule out any other conditions. And it helps in classification of members into exposure to specific potential vehicle, and if they're actually ill or not, but with any other disease or the thing we're investigating. Then we finally write a report. So this report must contain all the preliminary details, the ecological factors, so the report should be complete and convincing, right? And it must give a background about all the geographical locations. It must give historical data, method of investigations I've already mentioned, and then the analysis of data, clinical data, all the signs and symptoms, epidemiological data, that is time of occurrence, place, population, mode of transmission, laboratory data, and the different control measures that have been successful in achieving to bring down the epidemic. Right? So all of this. So the report should summarize your whole investigation and give a clear-cut idea about the epidemic and its prevention. So this is all about investigate an epidemic. So I hope you got a clear idea on how to approach an epidemic and how to investigate it. And please do like, share, and subscribe to our channel, and see you there.